Hi everybody, welcome back to our YouTube channel. My name is Dr. Mike Blaney, bariatric surgeon in Augusta, Georgia. Today we're going to talk about tips on avoiding weight gain after weight loss surgery. So this is a common concern for individuals, and if you've had weight loss surgery and you've gained a little weight, you've probably freaked out over the prospect or the thought of I'm going to regain all of my weight back. Most of the time that doesn't happen. And here are some tips that will help you avoid problems that you may be concerned about in the future. The first tip that we have for everybody is see your doctor who did your surgery. Follow up with the team that performed your surgery and follow their program. What your surgeon and your dietitian have learned is over many years of experience seeing thousands of patients, and they know what's best for you. And the follow-up is really a critical key component, because what I found in my own personal practice, individuals that gain a little weight, they tend to feel ashamed and embarrassed and avoid coming back in. Now, ultimately, they may come back in, but it may be many years later after they've gained a lot more weight than they would have liked to have seen, and it's a heck of a lot easier for us to deal with an individual who may have gained 10 pounds as opposed to gaining 50 or more pounds. The next tip that we have is find a support person. You know, this doesn't necessarily need to be somebody who had weight loss surgery, but that oftentimes is helpful. Most programs have a support group. Seek out those support people within the support group. An individual can be your partner for exercising. They can be your partner for advice when you're having a hard time or you're feeling down or struggling with certain stresses in your life. There'll be a constant reminder of what you need to do to stay on track. Another tip that we find helpful for our patients is keep an activity log. Log your daily activity. Writing down what you're doing on a day-to-day basis helps us stay organized and stay on track. Along those same lines is keeping a food diary. And there's a whole lot of different phone applications out there now that you can download that will help you track your food and track your activity. Getting these wearable devices that you can wear that will track how many steps you're taking is oftentimes very helpful to keep you motivated and keep you on track. And also when you go back into the office to see your weight loss surgery team, having this data on hand is very helpful for them to help give you counseling and guidance about what you may or may not be eating. I can't tell you the number of times patients think they're eating the right foods to have a low calorie, low carbohydrate, high protein diet, but in fact they're oftentimes eating foods that are contradictory to maintaining their weight loss. Another tip that we tell our patients is drink plenty of water. We'd rather have you drinking water throughout the day than snacking, because this will tend to, at least to some degree, give you some degree of fullness. Lastly, what I tell patients in order to summarize what we just talked about is what I personally call the 3 F's: food, fitness, and follow-up. Those are the 3 key behavioral components that you will need to engage in order to maintain your weight loss long-term. Food is eating right. I think we all tend to have a general idea of what we think that means, but to me it means focusing on a high protein, low carbohydrate diet, and the only way I can explain this to individuals is follow what I personally call the food test rule. Did it walk, swim, fly, or come from an animal? If it did, it's protein. Everything else is carbohydrates except for green vegetables. So try to avoid a lot of those foods that contain mostly carbohydrates. The second F, fitness, self-explanatory. Be active, be engaged in a daily activity routine. It can be as simple as walking around your block. You don't need to go to the gym for 6 hours and kill yourself, but do something on a regular basis that is going to tend to be a little more physically stressful than just walking around your house. And the third F is follow-up, critical. I can't stress the importance of seeing your bariatric team on a regular basis. Just the accountability of having to show up, weigh in, and sit down and talk with your surgeon or dietitian about what you're eating. And if we had experienced a bit of weight gain between the last follow-up visit, it's a heck of a lot easier to deal with it right then than it is to deal with it a year or 2 later, because you were avoiding appointments and then maybe weighing a bit more than you otherwise would have been had you dealt with it earlier in the course of events. So, for more interesting information about weight loss surgery, please remember to subscribe to our YouTube channel.